Hello, welcome to Eskimo TV. I'm talking today to Dr. Bob Chatterjee. Dr. Chatterjee is a consultant spinal surgeon and director of the North London Spine Unit. Hi, Dr. Chatterjee, how are you?
Hello, I'm very well, thank you.
Dr. Chatterjee, today we're talking about herniated discs. So what is a herniated disc?
So the discs normally sit between the vertebrae within the spinal canal, and they're quite sort of anatomically precise about where they are supposed to be. A herniated disc is when the outer coating of a disc bursts, and that allows the inner material of the disc to escape into an abnormal position. They're also known as prolapse discs, or sometimes people call them slip discs, but they all refer to the same condition.
Who is at risk for getting a herniated disc?
It changes as you go through the ages. So young people often get a herniated disc as a result of a sudden lifting where they've overloaded their back and sprained it to the point that the disc will rupture. Whereas older people, although they can have that mechanism, they also tend to get degenerative disc disease where the disc gradually, as they age, become less elastic and become more dehydrated, and that predisposes them to rupturing. I think the other thing to say is that recent studies have shown that there's quite a strong genetic predisposition for a ruptured disc. And sometimes we see them running in families, and so even though you may have done nothing to deserve it, one can sometimes sustain one of these unfortunate injuries.
What are the signs and symptoms of this condition?
It's quite a typical story, actually. Usually people complain initially of back pain, sometimes out of the blue or sometimes after a particular event. And that back pain then suddenly gets superseded about a day later with terrible, unremitting pain that tends to shoot all the way down the leg. The key feature is that the pain almost always typically goes below the knee, right down to the foot. And the symptoms most patients complain about are back pain, leg pain, some numbness or lack of precise feeling in the legs, and also sometimes, if it's severe, they can also get weakness in some of the muscles of the leg and foot.
So how is a herniated disc diagnosed and treated?
So as with most medical physicians, the first thing is that we take a good history from the patient, listen to the story about what's happened, and we do a physical examination. There are certain tests in the physical examination that can demonstrate to us whether a nerve is under tension or pressure or might be being pinched by a disc at the back. But the definitive diagnosis is usually made by an MRI scan. X-rays are not usually helpful in this condition, but the MRI scan can give us excellent information about the discs, the spinal cord and nerves around it, and it will tell us where the problem is originating and how severe it might be.
What are the treatment options available? At what stage does surgery become an option?
So the important thing to say about discs is that most of them will get better on their own. And that can typically take anywhere from a few months to possibly a year, but the vast majority will get better. The trouble is that sometimes the symptoms are so bad it's difficult to ask a patient to wait that long. So we normally prefer the body to heal itself, and sometimes we will use injections into the spine as a way of ameliorating the symptoms so that you can allow your body to heal itself. On the other hand, there are occasions when surgery becomes necessary. There is a particular condition called Cordra-Quina syndrome, which although is rare, can be potentially devastating. And this is when one gets a large herniated disc that actually presses at the midline of the spinal cord itself. And unfortunately, within a matter of hours, it will cause irreversible damage to the control of the bowel or bladder. That does require emergency surgery, often in the middle of the night.
Is it possible for people to prevent discs from herniating?
Not entirely, but there are things one can do. Again, maintaining a good physical fitness, and that means not being overweight, having a good, healthy diet, not being a smoker. These things are certainly known to affect the likelihood of a disc prolapse. If you're being taught correct methods of lifting so that you bend at the knees and lift something up from the bottom up rather than bending your back over, that will also help. As I said, despite these measures, because there often is a genetic connection as to why one develops a disc, it's not an entirely preventable condition.
Thank you, Dr. Chatterjee. Thank you so much for talking to me today.
That's my pleasure. Thank you.